Heather is a naturopathic physician specializing in oncology. She's done a lot of special training. She also, because I know her very well, we're close friends, she's constantly studying meditation, energy medicine. She's got a lot of great stress reduction techniques. She's recently shared a free resource called, can you tell me what your?
The Science and Soul of Healing, and it's at soulofhealing.com. We have over 25 experts talking about how you can heal yourself from the inside out, how you can heal without using supplements and without using special diets, and or if you're using supplements and diets and there's still something missing in your healthcare journey, that is where the Science and Soul of Healing comes in, because we know that there's this other force that creates vitality within us and creates good health, and that force is often is often overlooked by some of us who are like you and I both can be. It's really good to have these markers like lab testing and stuff to give us feedback on what's going on in our physical body, but what's going on in our spiritual body and our emotional body. And that's what the Science and Soul of Healing is all about.
And tell me that link again.
soulofhealing.com.
Okay. Yeah, and it's simplifying it a bit, but just a lot of people are feeling stressed right now, and some of them for good reason. I was just hearing that 3.3 million people filed for unemployment last week. It's like
wow,
a record. Yeah, it's a record in our nation's history. So there's valid reasons, but also when that runs wild, we're not sleeping. We start to feel more achy, and then we're like, oh, is my immune system going down now? So managing that energetic response is so important. So thanks for that resource.
Absolutely.
Yeah, let's dig into, you said not many people are talking about what's different now that there's COVID when you have cancer. So what is different? What should we know?
Oh my gosh.
Cancer,
so as you guys know, Bridget has been doing an amazing job in keeping on top of COVID-19 for weeks now. This is not a new topic for her. And like her, I've been trying to keep on top of this as a physician, as somebody who has a clinic, making sure that our clinic is taking the right steps to protect my immunocompromised patients, make sure that I'm not putting them at risk. So I usually have so many things memorized. I really do have a really amazing filing cabinet of a brain, but because things are changing so rapidly, I am going to be reading my notes, guys. So I just want to be transparent. If I'm looking down, it's because
so much information. Yeah.
I was reading research studies this morning to get prepared for this conversation, making sure my stuff was up to date, making sure that I was making notes of any changes. So there's just, as you guys know from watching the news or hearing from your local leaders or hearing from us, things are moving quick and we're learning more and more with each passing moment. So do you want to hear? Okay.
Yeah,
so you want to
hear what you're collecting there.
Okay, see what's on my notepad. So the first and foremost thing is people with cancer or people with loved ones who have been diagnosed with cancer are wondering if they have an increased risk of COVID-19, right? You're going through cancer treatment, you're immunocompromised, your white blood cell count is suppressed, or sometimes even if you're a cancer survivor, your immune system is shifted by cancer treatments in the past. So I wanted to make sure I gave you accurate, up-to-date numbers. So as of today, and this was just updated by the American Society of Clinical Oncology. So this is ASCO, and they're pulling their data from the World Health Organization. So these are really good numbers. No, crazy sources here. But as of the last 24 hours, what they think the risk of getting COVID-19 or this coronavirus in people with cancer is about 7.6% is the risk of getting this infection. The overall population has a risk of about 3.5% of having this infection or actually having like complications from this infection. Now, when we compare this to the other high risk groups that you guys have been hearing about, like people who have high blood pressure or cardiovascular disease. So someone with high blood pressure has an 8.4% risk of having complications with a COVID-19 infection. So having a history of cancer or going through cancer treatment puts you at a little bit lower risk than having high blood pressure, puts you at a lower risk than diabetes, which is 9.2%, and puts you at a much lower risk than cardiovascular disease, which is at 13.2%. So overall, people with cancer are at higher risk of complications than the general population. But in terms of when they say, you're at higher risk if you have other health conditions or, as we're putting it, comorbidities, cancer is lower on that list in the comorbidities.
Okay, I think that makes sense. And we can talk more about, and you kind of turned me on to something I studied more, which was like lymphocyte rates. I would say maybe something you will consider is like, we know with certain tissues now and certain potentially medications, although they're not at all saying come off medications, that lung tissue, heart tissue, certain tissues are a little more vulnerable to the virus kind of latching on. So I even wonder if people who are dealing with like a lung cancer could be a little bit more susceptible right now.
Yeah, we don't really know from the data. I mean, there's lumping cancer together as a big group. There was one very small study showing that people out of China, showing that people with a history of cancer also had an increased risk of morbidity, so of death and being needed to be admitted to the ICU and ventilation, even if they just had a history of cancer. But then they weren't taking into account there's only 18 people out of about 1,500 people that met that criteria, and they weren't taking into account, were they smoking or not, and what other kind of comorbidities they had. So that's the only information we know, right? That's all we know right now. Like we could definitely speculate, right? Like speculation is so freaking tempting right now, you guys. And I'm sure that you're going through this too. And so I could speculate. I wonder if, these are things that cross my mind. I wonder if people who already have compromised lung tissue might be at greater risk. And compromised lung tissue could look like previous history of radiation that might have hit the lungs, like maybe not to the lungs, but might have hit the lungs, maybe lung cancer, maybe, when we're talking about people with cardiovascular disease, well, does that include cardiomyopathy? So heart enlargement and heart changes that happen with chemo and radiation. We don't know.
Right. A lot of it, it's so quickly moving, and you're right. It's so easy to speculate. I've been digging into more actual facts on like, does autoimmunity actually, lower your immune system, and really how much is it enough to make you, more at risk? And it's probably similar to what you're describing. And it depends on the severity too, the severity of the position you're in, because you could be autoimmune and, super functional, or you could have had lupus and you're really not doing well, and it's kind of a different scenario. So you're right, super easy to speculate. I think there's been plenty of speculating online, and in the end, a lot of the recommendations are the same, right? About staying home and managing stress. What are some other things you think are, which is kind of safe general guidelines right now?
Yeah. So, one of the things that I am encouraging my patients to do is to advocate for virtual appointments with their oncologist. If they don't need to go into their clinics, to try to stay out of their clinics. If they can, one of the things that's being advocated for in general for people with cancer is to ask for home lab draws. So have people who can draw your labs come to your house, which it has been available for years and years, but only now is that kind of getting integrated into bigger health systems. So you can ask for people to draw your labs at your home instead of you going into the clinic. You can ask for virtual appointments if if your oncologist thinks that that's a safe choice for you. And then the other thing that's being recommended right now is even putting off screening. So if you're somebody who has your mammogram coming up or your colonoscopy coming up, they're recommending that you put off that type of screening for anywhere from 3 months to 6 months to reduce your risk of exposure. Now, that doesn't mean like if you feel a lump right now and you're like, oh, well, I'm going to put off this screening. No, like
Right. Okay.
go, and they are advocating, and I am advocating that you get diagnostic procedures done, that you don't put off diagnostic procedures. If you have blood in your stool, go for the colonoscopy, right? But if it's an annual screening, then definitely bump that appointment out by at least a month, if not 3 months. And they're even recommending this for people who get screening CT scans to watch the progression of their disease, and asking them to call their oncologist and see how far out they can push it. Do they need the screening imaging right now, or can they push it out another 3 months to 6 months? So it really depends on your type of cancer, your stage of cancer, what kind of treatment you were going through in the past, what the right next step is. But a lot of people can even space out their interactions with healthcare facilities right now by shifting the dates of those imaging studies.
Okay, well, I think that's good advice. You have clients and some people who may find this video may be already in treatment. What should they do? Should they do anything differently?
So right now, there are no recommendations to stop treatment or slow down treatment. And there's no evidence that people undergoing cancer treatment are at higher risk for COVID-19 than anybody else within the cancer population, people with cancer. So yeah, I mean, that's scary, right? Like I was talking to someone yesterday. I was talking to one of my patients yesterday, and she was like, oh my gosh, I know that for the next 4 days, my white blood cell count's going to be tanked out. And
Right.
I'm like, what am I going to do? I'm scared. Like everybody might get sick right now, and I'm really scared. So I totally get it. But at this time, one of the things that's been shown in cancer studies in the past is that the more you stay on schedule with chemotherapy, the more effective chemotherapy is. That's why I always advocate for using natural therapies, natural supplements alongside conventional treatments, because it helps you stay on treatment by supporting your white blood cell count, supporting your platelets and red blood cells, and making sure you don't have to pause treatment because of abnormal blood counts. But the more you stay on track with your chemo, the more likely it is to have benefit. With radiation, if you pause radiation even for a week or two, the efficacy of when you resume it is very, very diminished. So at this moment, they're advising people to not forgo, do not skip out on your treatments, do not skip out on diagnostic criteria, do space out CT scanning, do space out potentially surgery if that's a conversation to have with your surgical oncologist. So these are the things that are being talked about right now amongst American oncologists.
That's really helpful. Okay. So I know you do integrative cancer care. So I know there's like kind of things to be careful with, or things could be beneficial. I wonder how can I say, like, what kind of integrative supports do you often do while people are in conventional treatment? Does some of that help for what we're going through now? Is there anything to like change or consider if people are at home and taking their multivitamin and fish oil? Is there any like concern?
Yeah, so there's a lot of things. So I'm like, one of the things I've been curious about is, are there things that my patients are already doing, that people with cancer are already doing, that might work against COVID-19, that might prove to be beneficial in the long run? And are there things that they already have in their cupboard and are there things that I already recommend that cross over into this particular viral infection? And the easy answer is like, yeah, absolutely. There are.
Yeah, there are.
There's a lot of crossover, and in a lot of crossover in what you do for helping people with reducing mold toxicities and, what they're taking for that too.
Yeah.
And for like general infections that cause fatigue and whatnot. So in cancer care, we're really focusing on keeping white blood cell counts normal. And that is a very common part of my day, looking at people's white blood cell counts and making sure that they're doing what they're supposed to be doing. So there are things that I recommend to help keep white blood cell counts normal during treatment that do happen to interplay here with COVID-19. And then there's just general things that we do to help reduce risk of infection alongside treatment that are overlapping with COVID-19. So like some of those things include zinc. So zinc is something that we use a lot in my practice when people do have low white blood cell counts and we're trying to reduce risk of infection.
Okay.
We use acupuncture and ear seeds to help reduce the side effect of low white blood cell counts.
Oh, okay.
And we also use things like IgG. I saw that you had in your store an IgG product to help support the production of white blood cells. Sometimes we'll use thymic protein A. So the thymus is where white blood cells mature. So if people are having low white blood cell count, we'll use a thymic protein, so thymic gland product. And then we use things like constitutional hydrotherapy, which is the application of hot and cold towels to the chest and to the back. And this helps improve red blood cell count and white blood cell count by stimulating. Actually, they're showing that the lungs make some of these blood cells. So we used to think, oh, somehow it's like magically stimulating the vis that is then improving your overall blood count. But actually, there is some local effect in stimulating the thymus and stimulating the lungs to produce more red blood cells and white blood cells. And then a simple thing that you can do to activate the lungs to improve immune function is deep breathing. So the more you utilize the lungs, the more you can improve white blood cell function.
Those are great tips. Awesome. Yeah, I was surprised they did some studying up on the liver, and that can make immune cells too, especially as you're older and your thymus gland is declining, and like the liver can do quite a bit for immunity. So there's just so much like overlap all over the place. It's really interesting. So another thing you told me to look at, or that you look at, is lymphocyte count. Can you explain what that is and why that's important?
So lymphocytes are the part of our immune system that is important in cancer care, because when lymphocytes are low, that can increase risk of infection. And it also, when lymphocytes are too high, it can increase risk of tumor growth. So we're always tracking lymphocytes in cancer care, trying to take a look at what their behavior is. And we're watching the neutrophils and lymphocytes together to make sure that they're acting in tandem and not one driving things more than the other. I'm sure you talk about that in autoimmunity, right?
You know, I've been learning just now as I study up on the immune system. Yeah, I saw a study about like monocytes versus lymphocytes or something in pancreatic or stomach cancer. And I was like, oh, this is really interesting. But you probably had to look at it a lot more closely than I have. I'm just curious now. I'm just curious for my own, why when it goes high, is that mean like the body's responding to a tumor? Is that what that means?
So what happens, it's similar to autoimmunity. What happens with cancer care is that our immune system can get numb to the cancer cells. So when lymphocytes are getting too high, it usually denotes that the immune system is acting improperly and that it might be searching for something but not reacting to anything. And then also when lymphocytes are high, that's considered, well, certain types of high lymphocytes can be linked to lymphomas. So that is just a part of a B cell abnormality that can then trigger or be a symptom of other types of cancer going on.
Okay, interesting. Yeah, I'm sure in your field you're all reading that really, really carefully. Those are some great tips. I put them in the chats. I'll try to get them into the YouTube later too. Any other tips you want to mention?
Yeah, so lymphocytes in particular are supported by elderberry. And I know you and I have
kind of word, yeah.
I know you and I have kind of laughed about this and had discussions about this privately. And like my personal take on the elderberry conundrum that's been started recently is that when it comes to elderberry, it's been shown to be antiviral for centuries. So, and it helps support lymphocyte function. And so from that perspective, I'm still encouraging my patients to use elderberry. It also has a really low risk of interfering with chemotherapies because of the part of the body that metabolizes elderberry. So it is something that is generally safe with chemotherapy. So it's just not on my radar as something to worry about creating any type of cytokine storm or anything like that. Actually, cancer itself is its own like cytokine storm. So there's all these cytokines happening in cancer care anyways. And we're measuring a lot of the cytokines that people are worried about in the cytokine storm. It's something that I measure in lab work with my patients. We're already looking at interleukin 6. We're already worried about interleukin 2. Like these are not new concerns in cancer care, and we know how to manage these concerns. And most of the cytokine issues are not related to natural product use, it's related to organ failure. So that is what the studies are showing. That's what the information is coming out with. And a cytokine storm is a natural progression of organ failure.
Yeah, I was on a pretty great webinar last night where they explained it. And, cytokines are these communication kind of molecules between immune cells. They pop up in all different sorts of mechanisms. They're part of communication. And the number, the amount that elderberry would increase it, I don't know if I'm going to get this right, but they might increase it by like 2 times, whereas in a cytokine storm, it's like times 6,000 or something. It's like completely like not even in the same neighborhood and in so much later stage. Another thing they said that I thought was funny is they're like, I think people just love this term cytokine storm because it's kind of spreading everywhere. Whereas you could also talk about fibrosis of the lungs or there's other things happening that aren't quite as, it hasn't quite captured the imagination of the public.
Yeah, well, and I don't know, like for me, this fear didn't start from the public. This fear started from a group of functional medicine doctors being like, oh my gosh, what if our things are going to cause this problem? Or like people who just are not steeped in the history of natural therapies. So as a naturopathic doctor, we study eclectic medicine, which was the original US Pharmacopoeia. Like that was the original book for the US Pharmacopoeia, which is now filled with, antidepressants and antibiotics and antivirals and all of the medications that we use. So the original Pharmacopoeia, the original pharmacy handbook, were things like elderberry. And if you don't understand the historical use of plants, or of these natural therapies, then you're likely to get worried because you haven't dug deep. You haven't read I've read the old pharmacology textbooks. Like that's the level of nerd I am. Thank you. And that's important information to know so that you can stay steady in the therapies that you recommend when new information comes forward, and you can be discerning about that new information.
Yeah, that's a good tip. I don't know why this is coming to mind, but in the Spanish flu I was reading, and a lot of the deaths may have been caused by all the aspirin that they were using. So I think that there can be things that, but that was such a, it was 100 years ago. It's a different time. So I think, and I don't know how long like kind of manufactured aspirin had been in use at that point. But yeah, you're talking about things that have been used for so long. And when you do really understand the mechanisms, you and I talked a couple weeks ago, and I'm like, I'm not really sure that like an herb could cause all this trouble. Like one doctor made a great analogy I used to make in fertility care. It's like herbs are like a chisel, and the cytokine storm is like a hammer. Like they're not together. So where I don't think if you're home and you're eating well and you're sleeping that you have to be taking tons of stuff. Although I love this tip about how it doesn't interfere with chemotherapy and increases lymphocytes. I think that's great. I don't think you have to be swallowing every herb you can get your hands on for protection. I don't think that's the core of it. But yeah, know that especially if you're working with someone like Heather, and you can work with someone like Heather, they're going to give you good advice. And I know you've seen actually an uptick in your appointments requested from existing clients. I don't know, maybe new clients too, who maybe do want that customized advice. I have this cancer. This is going on around me. Maybe some people are even have been in contact with someone who's been COVID, and they do have questions that you can help with.
Yeah, it's definitely a time to work with people one-on-one, right? To reach out and use whatever support is available to you, because there's first of all, there's a lot of misinformation. Second of all, there's not a lot of clear information about how to use natural therapies that are antiviral. And there's just nothing that replaces talking to someone about you as an individual, because that is how, for my patients, we're measuring cytokines in their blood on a regular basis. So I can look at their lab work and say, okay, based on this is what I would recommend. Based on this lab work about your cytokines, plus what we know about blocking viral replication, this is what I would recommend. But there are some general recommendations that I think apply to people with cancer as well as people without cancer.
Okay. Any other things you want to share before we kind of wrap up and share some more resources of yours?
Yeah. So one of the things that is emerging as a potential therapy, and I say potential because we just don't know what the therapy is going to be for COVID-19, but it's something that I use in my practice regardless of this current viral outbreak, is IV vitamin C.
Yes.
So IV vitamin C is often used in cancer care because it can create a hydrogen peroxide reaction within tumor cells. And when that hydrogen peroxide reaction happens in tumor cells, it creates the degradation or the breaking apart of cancer cells. So that's why we use it in high doses in my practice on a regular basis. Now we're seeing out of China some studies, and there's more and more data gathering right now. So it's being this IV vitamin C and COVID-19 information is being updated on a regular basis right now. But what we're seeing is that they were using between 10 and 20 grams in ICU beds when people were crashing and were not responding to any of the ventilation, were not responding to any of the therapies. And when they were given 10 to 20 grams of IV vitamin C, they were able to actually pull the people back out of their emergency state and back into a state of health. And they were so far of the case reports that we have in this moment, now more are going to come, so this might not be accurate information tomorrow. But so far, the information that we do have is that that all of the people who were given IV vitamin C survived. And we are starting to see some hospitals in New York institute the use of IV vitamin C in the hospitals because New York is one of the biggest affected areas right now in our country by COVID-19. So they're starting to use these ascorbic acid IV vitamin C protocols. Now, I'm encouraging my patients to, as long as they're not sick, and as long as they haven't been in contact with COVID-19, to maintain their IV vitamin C infusions right now as something that might be able to protect them. So,
yeah, I actually did a bunch of research on vitamin C today, and yeah, there's 2 current clinical trials in China. The doses they mentioned for this were 12 to 24 grams IV for severe cases, 6 to 12 for moderate cases. I know they've been used in conjunction with some other things. And I think I read it could be good for actual fluid in the lungs, which is really like when you hear about the need for ventilators, it's this overwhelming amount of fluid in the lungs and they have to crank the ventilators. So it's pretty scary, but yeah, they're seeing some good results with vitamin C. Honestly, Heather, I don't know what you think, but I've looked at a lot of studies. Even for prevention, dosage has to be pretty high for vitamin C. There really aren't like a lot of super positive studies that are like low dose, 500 or 1,000.
yeah, I mean, let's be honest, like my mom contacted me and was like, can you give me some vitamin C? Because she sees her own naturopath. I'm not her naturopath. She has her own naturopathic doctor. And she ran out of she's going to get low on her vitamin C that she takes on a regular basis as prescribed by her naturopathic doctor. And she's like, can you give me some? I'm like, no, Mom, whatever you have access to is what I have access to right now.
That's a hot item right now.
It's a hot item. But the bottom line is when my patients are asking me, should I add oral vitamin C? My overall response is no. Like that's not what the studies are on right now that are coming out of China. And we don't know I can say from a cancer perspective, oral vitamin C does not work the same way in the body as IV vitamin C. And I'm assuming that with this virus, the oral vitamin C might be protective for reducing risk of infection, but it's not going to have that same impact when you actually have the infection, because the ascorbic acid actually interferes with the viral capsid, so the envelope that the virus is housed in, and it just works best when it's directly in your bloodstream and having contact with viruses and bacteria and cancer cells that are circulating in your bloodstream directly, and it doesn't have to mess with that GI absorption part.
Yeah, vitamin C IV is definitely like gold standard. Liposomal vitamin C is better, but still needs a pretty high dose. I think oral, once you become sick, like initial sick, not in the ICU, I did read a positive study about 1 gram orally every 6 hours, and then 3 grams a day after that. I mean, it's a lot of vitamin C. If you only have 1 bottle to your name, maybe wait until you actually, feel like you have a sore throat or something's a little off to take it. We're kind of going into vitamin C, but you could almost pick on any nutrient right now. Some people are crazy about selenium right now. You mentioned zinc is really potent. The fact is that they all have benefits. So sometimes I hear people, I can't get vitamin C, like I'm screwed, but there's so many things that give you benefits. Your diet gives you benefits. A good, well-rounded multivitamin from a good practitioner source is going to have a lot of benefits. The more I research, B12 is helpful, folate's helpful. There's just a ton of stuff that's actually helpful. So I think a well-rounded approach is great. And use some things you have. Mostly we don't want to be running to the store, or a lot of things are out online. I'm a big fan of fish oil right now, and magnesium, which I don't hear a lot of talk about, but they're great for the lungs and asthma. Plus, they're really immune boosting and pretty well tolerated. So lots of options out
Yeah.
there.
And I just want to give maybe an encouragement to maintain your sense of empowerment too, because the original medicines, the original supplements were plants, and you can get plants no matter where you live. So Bridget and I were talking about going on a hike, but now we're like officially socially distancing.
I'm isolating from
this was a while ago, but I was talking to her because there's an herbalist that I follow, John Slattery, and he is a local regional herbalist to the Sonoran Desert, so to Tucson and Phoenix, and then parts of California. But there are plants you can Google local regional herbalism and your state and your city and find out what plants are in your backyard, because like I was like, oh shoot, I mean, I have elderberry, but elderberry's out of stock. So what if my patients get sick? How am I going to help them? Because the elderberry leaf is one of the Chinese medicine combinations that's being shown to be effective, again, from the studies in China. And so I started looking at things, and thankfully, John Slattery, this herbalist, mentioned that, hey, did you know that we have this other kind of elderberry, the same family, here in the Sonoran Desert, and it's just called Mexican elderberry. And you can harvest the leaves right now and dry them and make a tea. And I'm like, oh my gosh.
Elderberry, I write that down.
It's like, you don't need Sambucus from Europe. You can use the one
True.
Here.
Yeah, and the one that was studied the most for coronavirus that I mentioned to you was a totally different species, probably out of Asia, because it seems like they've done the most studies. So there are some very specific things have been studied for coronaviruses. They're not all from here. And like you said, ideally as an herbalist, you use what's local and you know it's local. One thing I'm loving seeing online now is people kind of like returning to a little bit of like homesteading, right? They're like, I'm trying to grow sprouts. I'm like trying to plant a garden. Like, it's great. You know, we've really lost a lot of this with the ability to just like go to the drive-through and the drugstore. So I think it's kind of fun and valuable, and there may be, you know, I hope some reinterest in some of these things. This local herbalist, I love to share his information, because honestly, for the majority of the population is really lost interest in that stuff. But maybe this can make us see, you know, okay, life feels really easy normally, but in the end, we need to be responsible for our own survival. And I know for me, I don't grow anything in my yard, you know? So it just kind of makes you think, and hopefully starting to think outside the box will make us like move into a culture that's, you know, I think hopefully a little better after all this.
Yeah, I don't grow anything in my yard either. I mean, we're both in Arizona, and cultivation is a whole different thing here.
It is.
But the only thing that I do grow in my yard, and you've probably seen it when you walk up to my front door, Bridget, is there's like this giant bush tree on the side of my yard, and it is chaparral. And
nice.
Multiple times I've had landscapers be like, you got to get that weed out of here. And I'm like, you will not take my chaparral. Because chaparral in the desert has long been used as an antiviral, as an antimicrobial, as a sunblock, as something to support the liver, as something to support overall health and wellness, but more specifically used for infections. And it's an amazing, amazing plant. So if you can just think of one plant in your area that would grow in your area that would support your health, or if something like this were to happen again where you had to shelter in place, or the supplement aisle is empty or you're out of stock of things, just one thing could be something that I think of it as something that not only will help me, but I had last January, I made a big tincture, like of a jar this big, several liters, that I plan on sharing with my patients right now if they start getting sick or when their loved ones starts getting sick, because it's such a great antiviral.
Yeah, nice. You mentioned chaparral and like just having one thing. I know my mom's on here and she's got some cooking herbs. Cooking herbs are fantastic. They're so powerful. Herbs like concentration wise, like more than food, are really powerful, and antioxidants, bioflavonoids, really great right now. And that is something I've been meaning to do, is just at least have a little herb garden that I can pick from, pretty easy to maintain. So yeah, I think that's a great idea. Well, I want to talk a little bit about what you do outside of Corona time, because it's pretty fascinating too.
It's Corona time.
You and I have talked about, a lot of people online talking about alternative cancer cure are pretty extreme, right? It's either like, you're just all into juicing or clinic in Mexico or whatever. And you obviously have a real passion for herbs and energy work, but you do an integrative approach where clients can still, or are encouraged to still, do some conventional treatments, but you supplement. Can you tell us more about that?
Yeah. So what I have seen in my life is that there does seem to be a divide. Like either you have to choose conventional treatment with chemo, radiation surgery, or you have to choose natural therapy. And it feels like that a lot of the time, like you're either on team A or team B. And what I see in my cancer practice is that actually when team A and team B come together, that's when we have the most powerful results. So that's what I encourage people to do, and that's what I support people through. And when we bring natural medicine and conventional treatments together, we're able to use those conventional treatments to rapidly block tumor growth, and then apply natural therapies to reduce long-term side effects, to support your organ systems functioning well, to actually reduce risk of recurrence, and really, if you have stage 4 cancer and you're on cancer treatments, I see that it improves long-term treatment with stage 4 cancer as well as early stage cancer.
Mm. I know you work at the naturopathic college too, and you've trained at like a cancer center. Have you participated in different studies along these lines of using integrative care?
Yeah, so when I was in residency at the Center for Cancer Care in Goshen, Indiana, which is part of Goshen General Hospital, we did have a couple of clinical trials going on using some green tea extract, and the results of those trials were in combination with chemotherapy. And then I have myself had some case studies presented at the Society for Integrative Oncology as a poster presentation, and look to expand some of the trials going on at the Southwest College of Naturopathic Medicine when it comes to cancer care.
Cool. Well, I've been to your clinic. It's lovely. Even if you don't have cancer, you can go for acupuncture. I've had an IV with you. You've given me tinctures. Yeah, it's really lovely. I know people aren't traveling in this moment, but people will be traveling again. You're in Tempe, Arizona. And you also practice telemedicine. You have been for a long time. So can people come to you even for that first visit with telemedicine?
So it's not technically telemedicine if we only meet virtually. For our first visit, I can consult with you long distance. So I've consulted with people all across the country, all over the world, actually. And that is just another part of my day. And right after we finish this conversation, I'll be jumping on a call with somebody from Indiana, and I have patients in Texas and Florida, in the Carolinas, like basically everywhere. I think I should keep like a little map that has pins in it from where people are from, a world map, because I support people in Europe and in parts of the Middle East. And just,
Nice.
I mean, it's really a blessing to be able to provide this information to people no matter where they live.
Awesome. Well, again, your sites are drheatherpaulson.com. I know you have some like downloads there. And then you mentioned the soulofhealing.com is this free resource available now for taking care of your energy body and your stress and your mood right now during this time. So thank you so much for coming on. I appreciate all your sharing.
Yeah, thanks for having me. And it's so fun to talk to you and
Professionally.
Professionally, not just a coffee chat.
Yeah, it was really great. Thanks to everyone who attended. If you have any questions for me or Heather that you weren't, able to ask today, you are welcome to reach out to us later. Bye, guys.